Hi, my name is Leah Wanamaker, and this is my research presentation for EDFN 545. So, my article it was titled The Nationwide Analysis of Child Development Amid the COVID-19 Pandemic. So, the introduction is my article focused on obviously child development during the COVID-19 pandemic. So, March 11th, 2020, COVID-19 was declared a global pandemic. Changes affected everyone, including children, which is something that I don't think we look at enough. We think about how the adults and everybody was affected, but we don't think about the children. Caregivers were exposed to more stress during this time. That includes parents, teachers, childcare workers. Everyone's lives changed during this time. The aim of this study is to compare children that were born during the COVID-19 pandemic to the children who were born before the pandemic to show if there were any developmental delays of children born during the pandemic. So the study followed Israeli children from ages birth to 2 years old. The data was used from electronic medical records, so it was taken from medical records from doctors. It followed the developmental milestones developed into four categories. So, gross motor, there were two milestones that were tracked. Fine motor, there was one milestone. Language, there was one milestone. And social emotional, there were two milestones that were tracked. The results, I used the graph from the article. Out of 100 children, so 52 male, 48 female, which is a pretty balanced study. They talked about in some of the articles with the issue with like Vygotsky and Piaget's studies was that it was more male centered than female. So to see a study where it's 52 male, 48 female is pretty great because it shows a balance. Found that infants born during the pandemic had slightly higher rates of delayed milestones than children who were born before the pandemic. Language showed the most significant delay. So on the left is the pandemic group, on the right is the pre pandemic group. And all of those developmental delays are higher than children who were born post pre pandemic. This leads to the discussion. Children had a higher rate of delayed milestones when born during the pandemic. It's explained by a lack of social interaction during the pandemic when they basically only had interactions with their parents or saw people through a screen or only saw half of their face if they went out because they were wearing a mask. Children with confirmed positive tests of COVID were not used in the study. So if they tested positive for COVID, they were not included. They were concerned that with a child already having COVID, that would either delay the milestones further or it wouldn't be valid data. They looked at the socioeconomic status of the families. So that was kind of a factor. They looked to see if children from more impoverished ridden areas had a different developmental delay than children who were born in like higher class with like more opportunities. And they looked at when the children were born. Were they born early on in the pandemic or later on in the pandemic? And the children born like right in the midst of the pandemic had higher developmental delays. Implications from the findings. Will this change the way childcare and development is handled and seen? Will they have to change the developmental milestones and what age they'll have to be to reach that milestone? They suggested more outdoor social gathering for children to be a part of if for some reason another pandemic does happen or something like this happens again, having more outdoor gatherings for children so they can interact with children and they're not just with the same couple people. It also talked about the preparedness of healthcare workers and childcare systems for possible future pandemics. What do healthcare providers and childcare centers have to do in order to stay open and be a place where children can go to help reach those milestones, and what do healthcare workers have to do um, to help children. Um, it also talks about future children born during other major events and children born post COVID. Do they have to change? What will they have to change to make things better for children born post COVID? Um, Part of I took kind of part of my own implication. Part of the reason I chose this topic is because I last year I had the children who were born during COVID, and I've been teaching for almost 10 years at this point. It was my hardest year to date last year. My group, they were the most, they were more emotionally dependent, more emotional and behavioral issues, and severe behavioral issues. Throwing chairs, hitting, kicking, punching. Um, and then children struggled with learning due to the number of emotional outbursts and that were occurring daily. So my students last year struggled with learning because of how many outbursts these students had. And it was nothing like what I had the previous year, and it's nothing like I had this year. So I was like, okay, what is the common denominator here? These children were born during COVID. So that was kind of where my inspiration for this study, to find a study like this, came from. Connections to class resources. Nature versus nurture. So a child's biology versus their environment. Um, Children born during COVID had one environment. It was normally their home. Um, Whereas children born pre and post COVID, they have school, they have playgrounds, they have daycare. They're all still open. So it talks about the nature versus nurture, and Vygotsky's sociocultural theory about nature versus nurture. Zone of proximal development. So children's actual development level versus their potential development. Um, do we have to look more at their potential development because of the COVID-19 pandemic? Or do we have to look more at their actual development level? Where are they versus where should they be? Um, Children have pivotal brain development during their younger years of life. Um, that just any study on the brain can show children's pivotal development is between the ages of birth to about 5. That's when everything they're learning, all their emotions, all of their brains are like putty at that point. So it made me think of the Distracted Minds video, where if children have like 50 things going on during the day, especially the children who had school via Zoom and stuff, and like had to be in front of a screen and also doing schoolwork and also dealing with maybe siblings around them. Um, Correlation studies. So the two variables are the COVID-19 pandemic and children's development. Um, it is a naturalistic observation, observing children in their homes and schools, because that's their natural environment. The target framework. Do we have to change the way we teach these children? Do we have to change the target of what we are trying to do? The last two kind of coincide: parental involvement, um, and types of parenting styles. So in the TED Talk video, they talked about children being raised in the exact same house, but turning out totally different. So that leads kind of into like a child born pre COVID who's a sibling, and a child born during COVID who's a sibling. The first child had normal social interactions. Um, they had friends, they had school. Whereas the children born during COVID and like went to school during COVID, They didn't get that. They had school in front of an iPad and interactions with people on screen. So one sibling turning out a completely different way than another sibling has nothing to do with the parenting. It just has to do with the child. And parental involvement. Obviously, parents were home with their kids during COVID, so they were forced to be home. So obviously, one child is going to turn out different if their parents are working all the time versus forced to stay home during a pandemic. Thank you for listening to my presentation.